Now the floor is open for question and answers. So I hope presenters can answer. So anyone can ask questions. I hope there will be a mic.
Can I start by asking a question from Dr. Nadika? Dr. Nadika, this on getting men involved in family planning, you had several recommendations. What would be if I gave you 3 things to tell us how we can programmatically get men more involved, what would be the 3 things that we can practically do?
Actually, so one thing according to my knowledge and experience, usually PHMs, they do home visits. So they discuss with these things with most of the time with the female spouse only. So they can discuss with both the spouses, male and female spouses. They are at the same place and discuss with both of them. Most of the time they discuss only with the female spouse. Male partner does not participate in that discussion. So that is one thing. And the other thing is, in our family planning clinics, most of the time only the female partner contributes. Even if the male partner comes, he just comes after the gate but does not come inside. So he should come inside and he should be there when the counseling is being done. I mean, both the couple should be there when the PHM or the doctor or the PHNS or someone discussing these things with the female partner. The male partner also should be there. The contraceptive counseling should be target both the partners. That is the second thing. And I think the other thing, because they have a lot of fear about these side effects and infertility, subfertility. So we have to address that part, because in my experience I have seen, even if the female partner accepts the method, later she comes to get it removed because the husband doesn't like to keep it. He thinks it can cause some kind of it can cause subfertility, infertility, any other harmful health effect like that. There are a lot of misconceptions. So that male spouses, that fear of side effects and potential for the infertility, subfertility, that aspect has to be addressed.
Thank you very much. I think that point is taken, educating the clients about the side effects. I think that's important. I think it also came up in another presentation. The first point you said, when the public health midwife goes to the house, most of the time, I did 3 household surveys in the month of October, and none of the houses had males in it because they had gone for work.
That time
so the timing is a bit of a problem. So that is practically it's not possible, but encouraging the males to the clinic whenever they come, that's a possibility. And it's not all the time that the males accompany the wife or the female partner, but whenever they come, I think it's a good point to encourage them also to come to the clinic and listen to the counseling session. Thank you very much.
Hi, I'm Hasini. I'm representing ARROW, that is the Asian Pacific Resource and Research Center for Women. I think I saw a couple of studies where the focus was on the knowledge of women on contraception. From the point of view of civil society organization, my question also hinges upon what was just discussed about the lack of male participation in discussing family planning methods. Is there any reason why the studies were focusing only on the knowledge of females, women on family planning methods and educating women on family planning methods? Why wasn't there a gender neutral study when you sampled out your sample population? I think Migaras, and there was another study that followed which focused only on knowledge of women on family planning methods.
Thank you for the question. So as I'm not a medical practitioner, so I am coming from a social background. So when it comes to the males and females, main thing is majority of the sexual and reproductive health concerns are based on females, specifically for the 15 to 49 of reproductive age group. So that's why basically majority of researchers are mainly focuses on females. But in social sciences, we are trying to explain and elaborate how the men are actively participate for these kind of decision making and practice SRH related practices. But actually the thing you pointed out is very well taken in our researchers, because we have to have as you mentioned, in gender neutral manner, we have to study about those things. So as a social researcher, I will very well taken about that point as well.
For me, our study is an undergraduate study, so we have to select a study population that is feasible for us. So in the hospital setup only, we can get the most patients, most study population we can get. In that also, if you are going to take male population, you have to go to the medical ward. In the medical ward, most of the males are above the age of the reproductive age. So in the female also, we had a really tough choice which ward to choose. In that also, we couldn't choose any gynecology ward because they will have a problem in subfertility or infertility. Asking them these questions are not sensible. So we had to choose pediatrics. sex. That is the only reason we chose the female population. In female population also, we asked about the condom use and what are the idea about male contraceptives. We asked about them. We couldn't access the male study population. That's the issue.
Hello, good afternoon. My name is Dr. Nilesh and I am from Family Planning Association of India. I have a question for Dr. Migara, and it was a quite interesting presentation. Traditional methods versus modern contraceptive method. You presented in one of your slide, it says that by education and even by the sector, living place, or I think wealth quantile, more the education, more the wealth quantile, the traditional practice method use is also more, right? And then for the modern contraceptive also it says the same. That was quite confusing, that how come education increases and still modern contraception and traditional methods in the same age group, not same category, one variable like reading positive. It may happen, but how do as a programmer, it may statistically happen, but how do as a programmer you infer it? What's your suggestion? This is the question. And then just out of interest, I just wanted to know whether you explored when you were studying the traditional method, which to me appears quite high, the uses of traditional method in Sri Lanka as per your data. What's the outcome, whether it led to pregnancies or not? If I'm not sure whether you explored in your study, but just out of curiosity, the second question.
Thank you very much for both two questions. For the first question, as you've seen in the slides, this is totally based on statistical analysis. But when it comes to grassroots level, there are so many different factors are contributing to those findings. So very basically, in most of the traditional family planning users, they are belongs to the highest wealth quantile. So it means that some sort of wealthier people are not preferred to use modern family planning methods. Just that they are believing on the traditional family planning methods. And also when it comes to the some sort of education level, that they think that they are in modern family planning methods, they are having some sort of myths with regard to the modern methods. That's why they're having those kind of things. Yeah. That's the thing. Because I have done very few interview-based study in because I am coming from University of Colombo. So some of the academia also having some sort of a beliefs that having some sort of infertility, subfertility, and some of the modern methods will cause some cancers. Likewise, if they use modern family planning methods than the traditional family planning methods. That's the thing with regard to that. For the second question, so high usage traditional planning method. According to the DHS in 2016, around 13% of ever married women are using traditional family planning methods. The thing is, as I mentioned, there is a doubt between the practice, because as we all know that in Sri Lanka, we are doing so many promotions and awareness programs. But with regard to some specific groups, especially among some youth groups, as well as some vulnerable groups, they are having some sort of issues or lack of awareness with regard to those things. And also, if they are using traditional family planning methods, they are having most of the women, those who are living in elder age categories among the reproductive age span, they are having some sort of elderly pregnancies as well. So this is some sort of a side effect, or it's not a side effect, but it's some sort of a bad thing not in our society, but they are think that in Sri Lankan society, they are having children in their later ages. It's some sort of a not culturally accepted, no. So that's why they are having some sort of misspells regarding the birth control methods.
Just a little comment. I don't know whether your second question was answered. So you generally asked what the outcome was. Lots of people were using natural family planning methods, and what the outcome was. There were many unplanned or unwanted pregnancies. Probably that was the question he was asking. But his study was basically on the demographic health survey, which was done 8 years ago. Now in many countries, usually every 4 or 5 years, they do the DHS. Unfortunately, in Sri Lanka, the last one was done in 2016. But just on that, in 2016, the unmet need for contraceptive use was 7.5%. And at that point in time, we also have the National Electronic RHMIS information system, and our data was very comparable to the DHS. So at that point in time, our unmet need for family planning was 7.5, and the DHS also, the unmet need for family planning was 7.5. But since then, our unmet need has now come down to 5.4, and even the use of natural methods have actually come down. So the number of unplanned, unwanted pregnancies have also come down. So that's like a comment for your question. Thank you.
Yeah, Dr. Lopamudra is also online, so if you have questions for her also, you can direct your questions. Any more questions?
Yeah, hello, I'm Madhushmita. I'm from India. I'm a student in social work public health. Me and my friends studies also on cultural and social barriers to family planning. I don't know the context of Sri Lanka, so when he was presenting, how education might not necessarily lead to use of modern contraceptive. So I want to understand if in Sri Lanka, what might be the social determinants then? Like what are the factors that might influence? If it is not education, then is it the culture, the the religion. I don't know, like if you could find out any other reason for non-use of modern contraceptive.
As I mentioned, there are so many factors which contribute to the traditional methods usage. The thing is, actually, as doctor said, that nowadays we are having a very low level of practice usage of traditional methods, but still we are having some sort of a percentage that we have to address. Actually, I think, as you mentioned, there are so many cultural and religious backgrounds are affect on those practices. As if you heard about listen to the plenary sessions at the morning, so they also said that there are some political as well as religious interferences are there with regard to the knowledge and everything. So in most of the Sinhalese, Tamils and Muslims are having very in-depth religious background. So most of their practices with regard to their marriage, their child preferences as well as their family planning methods and everything are having direct and indirect effects on their family planning behavior. So that, as I think, as a social research, I think mainly rather than education level, basically the culture, religion and other factors also directly and indirectly influence on the usage. I hope you got the answer.
Yeah, I think we can have one last question. Yeah.
Generally, family planning people use either any contraceptive method. But the thing is that whether it's in India or in Sri Lanka, the use of modern contraceptive methods is around 50-60%. A medically ill patient will take a medicine. But people using family planning are not patients. They are clients, they are otherwise healthy. So taking a medication, whether it's a pill, whether it's using a IUCD, it is an intervention. And always people are afraid of side effects. And whatever little side effects are there, they are blown up. So that is why whether they are educated, whether they are wealthier, they still fear using modern methods, and that's why they use the traditional methods. Or they don't use any method. Even I have seen educated people not using any contraceptive methods for the fear, even the modern contraceptive method, for the fear of having side effects. They can take any amount of antibiotics, any amount of analgesics without asking for side effects because they are suffering. They have pain or infection or whatever. But a person using a family planning method is not a diseased person. He or she is a healthy person. And when you want to use an intervention, you're scared of side effects. That is the main reason why people don't use contraceptive methods. And it is our duty to educate them about the better effects of using contraceptive and the bad effects of terminating an unwanted pregnancy. Thank you.
So thank you very much everyone for.
As Madam said, some are preferring the natural method because that is less side effect, but that's not true. Because if it's a medically proven thing, we know the side effects, we know which dose causes which adverse effects, we know that. In the traditional method, no studies have been done, pharmaceutically not approved. So many of them, most of the time in Jaffna also, last year one case happened, taking an Ayurvedic medicine, she came with a massive liver failure. If she had taken the normal medication given in the hospital, it wouldn't have caused that much of an effect. And in the contraceptive also, if they are gaining weight, that is not because of lipid deposition, it is because of the water content is increasing in their body. So we have to give a proper idea about what is the problem with the traditional method, what are the problem with the modern method. We have to clear both of them out.
So thank you very much. Because we were behind schedule, I would thank everyone, all the presenters and the participants for your active contribution, and also I thank my coach and my classmate for supporting me. Thank you very much.